Right, good evening. My name is Hannah Evans. I will be discussing the mumps disease. Essentially, I'll just go over a little about the bacteria that it comes from, the life cycle it goes through, the pathogenesis, and how they correlate together. Um, Virulence factors that contribute to the pathogenesis. We'll talk a little bit about some symptoms that are observed, possible complications, diagnosis, transmissions, treatments, and preventions. Okay, so paramoxovirus is the bacteria that it is known to originate from. This virus was discovered and documented by Claude D. Johnson and Ernest W. Goodpasture in 1934 by showing that it could be transmitted from infected patients to rhesus monkeys and demonstrated that mumps was caused by a filtrable agent found in saliva. This was finalized as a virus in 1935. Right here at the bottom, this picture here just kind of shows you what the mumps disease will do for you. This is the most common side effect of it. It does a lot more damage to your face, which is the most noticeable one, along with many other symptoms that we'll get into a little later. Right, so a little bit more about this bacteria. It is indeed gram-negative. It appears as a spherical, tube-like enveloped group of particles with a central helical nucleocapsid that are 150 to 300 nanometers in diameter. Right? This bacteria belongs to the Paramoxyviridae family. This family is known to be single-stranded RNA viruses known to cause a variety of different types of infections in vertebrates. Okay, a few other bacteria in this family, pretty sure you've heard of it. Maybe the pneumovirus, which is a bacteria that deals with respiratory syncytial viruses, and the morbilliviruses, which is most commonly associated with the measles virus. Right, so moving on into the life cycle, right? The life cycle. To begin with, we have the attachment phase, the entry phase, transcription, replication, assembly, budding, and spreading. Right, so the bacteria begins by attaching to the host cell membrane. It enters the cell by the release of the viral genome into the cytoplasm. The viral genome undergoes primary transcription to reduce mRNAs and is replicated in a two-step process catalyzed by the viral polymerase, where antigenome intermediates are produced from genomic templates before the production of negative sense genomes. The helical nucleocapsid is formed by association of the newly synthesized nucleoprotein with the nascent genomic RNA. This newly formed structure then interacts with the RNA-dependent RNA polymerase complex. Okay? All right, so the RNA polymerase complex, they are basically transported to the plasma membrane by the M protein, where they interact with surface glycoproteins for assembly, before membrane scission and the release of virus particles. Okay, so essentially they reproduce and spread by replicating within the cytoplasm of the infected cells, basically breaking off a piece of this viral particle and creating an identical one to go and affect another cell, if that makes sense. So moving on to the pathogenesis. Basically the virus infects the ciliated epithelial cells of the respiratory mucosa and disseminates locally. Right? The virus is acquired by respiratory droplets. It replicates in the nasopharynx and regional lymph nodes. After 12 to 25 days, a viremia occurs, which lasts from 3 to 5 days. During the viremia, the virus spreads to multiple tissues, including the meninges and glands such as the salivary, pancreas, testes, and ovaries. Okay? Right? So now I'm going to just go back to this page, right? So something that I want to come back to is the fact that it's a zoonotic pathogen. A zoonotic pathogen is essentially a pathogen that occurs naturally in an animal host, but is also able to infect humans. It's a pathogen that have recently emerged in humans and livestock in Australia and Southeast Asia. So with that being said, and knowing the life cycle and pathogenesis, something that was brought forth of my curiosity, or that piqued my curiosity, was just the fact of, okay, now that we know, okay, it's spread by literally like a respiratory infection. So you breathe on somebody, you get close to somebody, you touch something that's infected. You know what I'm saying? Like you automatically you automatically get sick. And the fact that it spreads so easily, it's going from cell to cell, spreading these viral particles is interesting to me. And the fact that it lasts so long and you're contagious throughout this whole time is something that is worrying and strange. What we wonder what will happen if there is another outbreak. We hope for the best, but anyways, okay. On to the virulence factors. So virulence factors consist of two primary glycoproteins. So we have the fusion protein, which essentially aids in the purification of cloned genes as reporters of expression level and is histochemical tags to enable visualization of the location of proteins in a cell, tissue, or organism. Okay. We also have the hemagglutinin neuraminidase, also known as the HN protein. This one is responsible for virus attachment. So essentially it interacts with the fusion protein in a virus type specific manner to induce efficient membrane fusion. Okay, so moving on to the symptoms. Over here on this side, you can see a little bit about the clinical phases. So if it was broken down into 3 stages, this would be stage 1. You're experiencing a little bit of headache, little malaise, little myalgia, little fever. As you move to stage 2, the fever gets worse. You're still keeping these symptoms, but you also begin to go through that viremia, which, just a reminder, is essentially the stage where the virus will spread to multiple tissues throughout the body. So with that being said, that's why you see a lot more dots here than you do here, and a lot more dots here than you do here. All this has to do with viremia and the virus spreading. As you move on to stage 3, you will experience more of the meningitis effects, the parotitis effects. This is the stage where you'll definitely get the orchitis, the viruria. It's very rare, but some people do experience deafness in this stage. Pancreatitis, encephalitis. So that's all of this picture name. A couple more that I found that I, wanted to keep in mind or wanted you to stay note of is the anorexia, the swelling of parotid glands, which is a very common one. Is basically a characteristic, or it basically causes the characteristic of a grimace appearance. Right? Testicular inflammation is also a common side effect in males. Right? Possible complications that may come from this would have to be joint pain or arthritis, which is the most common. Some people do get meningitis, neck stiffness, pancreatitis, myocarditis, and deafness, which, like I said, is pretty rare, but still possible. Okay? Now, this disease is most common to children under 10 years of age, which is why it's commonly referred to as a childhood disease. The diagnosis. Puffy cheeks and tender swollen jaws are definitely normally a sign of it. PCR and viral culture are used to confirm mumps infection. A buccal swab is preferred for mumps PCR. A throat swab is also acceptable, but not preferred. A buccal swab is basically will consist of massaging the buccal cavity, which is the space near the upper rear molars between the cheek and the teeth, for 30 seconds, and basically swabbing the area, obtaining a generous amount of swabbing. Okay? Transmission. So respiratory droplets or direct contact with saliva or anything carrying an infection can easily allow you to become infected. The infectious dose is 50% tissue culture. So, treatments. There is no effective treatment for mumps except for treating symptoms such as fever and malaise in children by using analgesics and fever reducers. Preventions. Vaccinations with 3 live attenuated mumps virus vaccines gives long-lasting immunity, but reinfection may occur. These vaccines are 95% effective. Okay, and this just shows you the rate of how many people got mumps from 1980 to 2000.